Dear Member States, colleagues, partners and friends, we have the tools and knowledge to eliminate a cancer. What we need is commitment, political will and collaboration to make it a reality. If we can ensure high uptake of HPV vaccination and quality, organized screening programs, we will be on track to eliminate cervical cancer. Our roadmap charts the course for our journey towards elimination. In this short video, we introduce the core principles and key actions. First, it is important to understand the nature and scale of the challenge we face in the region. Countries are at different starting points on the road to elimination, but we all face common challenges, and through collaboration and collective effort, we can achieve our goal. Cervical cancer is a preventable and curable disease if it is detected early and treated properly. Our destination for the WHO European region for 2030 is to have 90% of girls fully vaccinated with HPV vaccine by age 15. 70% of women screened using a high-performance test by age 35, and again by the age 45. 90% of women with precancer treated. 90% of women with invasive cancer managed. This roadmap was developed through extensive engagement with member states, civil society organizations, and key stakeholders. We have guiding principles that underpin our work to serve the most vulnerable and underserved groups, ensure broad engagement within and outside government, and follow a life course approach from HPV vaccination of adolescents to organized cervical cancer screening of women. We identified necessary strategic shifts or pivots for member states to take to successfully implement the roadmap. Strengthen the health system's governance and care pathways. Develop competent and trained health workforce. Adopt evidence-informed policy and communication strategies. Enhance data, surveillance, monitoring and evaluation. Support responsible innovation to accelerate elimination of cervical cancer. This roadmap is an ambitious plan, and so we highlight 3 priority action areas for member states to focus on. As of 2020, 38 of 53 member states had implemented HPV vaccination in their routine immunization programs. But we want to see this included in national programs of every member state, with effective communication strategies to achieve the 90% coverage target. The percentage of women ever screened for cervical cancer in the region ranges by country from 11% to 100%. We need screening programs that are organized and not ad hoc to ensure that all of the necessary services are provided from early detection to follow-up. Across the region, the chance of getting an early diagnosis varies considerably. 5-year survival rates range from 54% to 80%. 65% of the population has no access to palliative care services. We need to ensure access for all to a well-trained workforce and effective treatment that puts people at the heart. Is this a good investment? HPV vaccination and cervical cancer screening have been designated as best buy interventions with immediate returns on investment. Successful implementation of this roadmap requires strong political commitment from member states and appropriate investment in care pathways, workforce training, communications, and monitoring to ensure that no one is left behind. By striving to achieve the ambitious 90, 70, 90 global targets by 2030, all countries in the region are setting themselves on a pathway to eliminate cervical cancer as a public health problem. Let's make cervical cancer elimination our legacy.